Welcome, everybody, to our University of Toronto Novo Nordisk Network for Healthy Population seminar series. This is our monthly seminar, and we are thrilled that Dr. Blake Pollen will be speaking to us today. But before I introduce Blake, I just would like to start with a land acknowledgement. So I'm coming to you from the city of Toronto, which is covered by Treaty 13, that was signed with the Mississaugas of the Credit, the Williams Treaty, and the Williams treaties signed with the multiple Mississaugas and Chippewa bands. But I would mostly like to acknowledge the land on which the region of Peel operates, which is where University of Toronto Mississauga is situated and where we are coming, where we're hosting these seminars. So the region of Peel operates as part of the treaty lands and territories of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land, and in particular, we acknowledge the territory of the Anishinaabe, the Huron-Wendat, the Haudenosaunee, and the Ojibwe Chippewa peoples, as well as the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. And we're very grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. So welcome, everybody, and thank you for attending today's Network for Healthy Population seminar, which is entitled Working with Residents to Effect Change, a Connected Community Approach presented by Dr. Blake Pollen. Before I introduce you to Dr. Pollen, I'd also like to quickly review some housekeeping items. So we'd appreciate, I see everybody's done this already, for the audience muting themselves during today's presentation, and there will be an opportunity for questions at the end of the session. And we'll be inviting questions either through the chat box or you can use the raise hand function. If you have questions during the event, please enter them in the chat box and we'll do our very best to get to them at the end. As you know, today's session is virtual and it is being recorded, and we will make the recording available on the network's website. Now, I'd like to introduce our speaker for today. Dr. Blake Pollen is an associate professor in the Dalla Lana School of Public Health at the University of Toronto, a senior fellow with the Center for Critical Qualitative Health Research and director of the Collaborative Specialization in Community Development. Trained initially as a health geographer, his areas of specialization include community resilience, sustainability transitions, prefigurative social movements as agents of change, qualitative and dialogical methods, the settings approach in health promotion, and community development as an arena of practice for health and social care professionals. And we are so thrilled that Dr. Pollen is going to speak to us today about the work that he's been doing over his career, as well as some ideas and things for us to be able to learn from as we do the important work through the Network for Healthy Populations. So a lot of this work, of course, is highly relevant to what we're doing in our network. So without further ado, I will pass it on to Dr. Pollen. Thank you for joining us today.
Need to unmute. You'd think after a few years of that, I'd have figured that out. Thank you, Lorraine. It's a pleasure to be with you all here today, and thank you for the opportunity to present and share some views that that actually encompass quite a bit of my work over a number of years. And yeah, so this is passion work for me, so I'm delighted to be able to share it with the rest of you, and I hope some of you find some points of relevance here for the work that you're doing and the work that the network is doing more broadly, because I know you have ambitious goals for what you want to achieve in Peel. And I think a community-centered approach is something that is well worth exploring further as part of that work going forward. So let me see here if I can. I want to start by acknowledging some of the key thought leaders that have been part of this work. Whoops. And first and foremost, Anne Gloger, who's the founding director of the East Scarborough Storefront and the principal of the Catalyst Circle, formerly the Center for Connected Communities. We worked closely together for the last 15 years on a lot of this work. And a lot of what I'm presenting are really her ideas, and certainly the connected community approach itself comes out of 20 years of work at the East Scarborough Storefront. And it's something that we've been working together to adapt for our work on community resilience. And so the Daolana Community Resilience Research Group is a number of us that have come together to explore how a connected community approach can inform community resilience work. We've also worked closely with the Center for Connected Communities, which is now called the Catalyst Circle, and folks at the East Scarborough Storefront. I want to also point to some of the realities of what is the backdrop for this work as far as the network's engagement is concerned. And this is from a report that is soon to be released, just a few broad brushstroke items, but we know from this data and other work that the prevalence of diabetes in Peel region is quite a bit higher than the Ontario average. That the built environment has a huge role to play in that, and there are some key characteristics of many areas of Peel region that have a profound influence on diabetes rates and physical activity levels. We know that Peel also has a unique strength and uniqueness in terms of the components of visible minority, low income, and immigrant and newcomer populations who are disproportionately affected by diabetes and related health concerns. And we know from this work also that some key indicators of diabetes care quality fall short of guideline recommendations for substantial portions of this population. And so it's against this backdrop then that we talk about what does it mean to work with communities to address some of the underlying conditions and drivers of this work. And I particularly like this quote. This is something that Anne Gloger uses a lot in her presentations. When a flower does not bloom, you fix the environment in which it grows, not the flower. So I'm taking that broader context to step back from the focus that we find in a lot of health promotion work that is very much targeted to those at risk, or what we sometimes call vulnerable populations or marginalized groups, and step back to look at the broader conditions at the neighborhood level, but obviously scaling out from there to think about what are the core social and ecological and environmental determinants of health that are impacting this scenario. And part of that is thinking about collective lifestyles and the way in which neighborhood level factors influence health profiles and collective health profiles in particular. And I've been quite influenced by work by Kate Froelich, who is now the new director of IPPH at CIHR. We worked together a lot a couple of decades ago on collective lifestyles issues and how to best understand the social context for collective health outcomes. And there are many ways of portraying this, of course, but what I want to signal here is that there's a complex interplay between individual, group, and neighborhood level factors that have significant impact over the life course and in particular places. And so taking a place-based approach and a community-centered approach to this work is really key. And part of that is understanding the culture of place, both at an organizational and neighborhood level, understanding how power relations operate and impact on the emplacement of technologically mediated power relations in a given setting. And so what this forces us to look at then is that when we think about diabetes and related health challenges in an area like Peel, we need to be moving ourselves away from thinking about this as a straightforward problem that we can apply some kind of recipe or best practice to in a narrowly conceived way, or even something that's particularly complicated that needs extensive protocols and working from promising practice literature. Those are important, but the more we can understand how these things are complex problems that are a little bit more like raising a child than they are baking a cake or sending a rocket to the moon. So in when you're raising a child, for any of you who've done so, and I've had the pleasure of doing that, we recognize that rigid protocols are often not very helpful. You can read as many parenting books as you want. In the end, success with one is no guarantee of success with the next, and expertise helps, but it's responsiveness that is key. And every child, just like every neighborhood, is unique, and there's a lot of uncertainty. This, of course, is drawing from Wesley, Brenda Zimmerman, and Michael Patton's work on Getting to Maybe, a fantastic book about engaging emergence in community-based and work on complex issues. So the problem then that we face is that current knowledge and practices around management are not adequately sophisticated for engaging with complexity of the challenges to which most local governments and agencies must respond. And so, what we need to do is go beyond conventional risk management and health promotion responses. We have deeply entrenched racial and socioeconomic inequities in health and healthcare. We have a built environment that poses significant challenges and that is not evenly distributed. So, we have a major environmental justice issue at play. We have collective lifestyles that are a function of collective life chances that follow predictable lines in terms of race, class, gender, etc. And we have inequitable access to quality health care and tailored chronic disease management. So all of this really pushes us to go beyond conventional siloed agency-driven approaches to problem management and to recognize that health professionals only hold one piece of the puzzle. So how do we engage all stakeholders, including community residents and organizations, in knowledge co-production and collaborative change work? And that's really what I want to focus the rest of this presentation on. Part of that is understanding how health promotion itself evolves over time with respect to incorporating complexity into understanding how we design, implement, and evaluate interventions. And I'm not going to focus here on the details. This is just one example. And part of it is understanding how we bring a community focus to institutions and agencies that are in the health sector, particularly around clinical care. And a lot of the work that I've done previously is around health promoting hospitals. And those of you familiar with this work know that the idea behind a health promoting hospital, and this is something promoted by the WHO, is that it not only focuses on good quality treatment and care for patients in the hospital, but it also looks at how hospitals can become healthier workplaces for staff. We know that burnout and so on are key issues in the healthcare sector right now. We also look at how hospitals can be strong partners for public health in community settings and how they can be healthy and sustainable organizations in themselves. And so some of the work we've done in the past, 5 years worth of work looking at how hospitals engage with community groups to address determinants of health beyond the hospital walls. And we came up with quite a few examples, 30 or so across the province. These are just a couple of them here to give you an idea of how hospitals in Ontario have partnered with quite a range of community groups to address community health issues. And a lot of that has focused on an asset-based community development approach that doesn't just label communities by their deficits or be part of what is a growing social service industry funded on the basis of needs. And that's often how we articulate, the basis for our work, but then we end up sort of labeling communities by their deficits, and we want to move beyond that and take a strengths-based approach. And build on community assets and strengths. Of course, a lot of this work comes from John McKnight's work in Chicago and elsewhere that's about asset mapping. And you see an example of that on the right here. But it's really taking a broad lens at who are all of the players who have an influence in some way or have something to contribute to this work. And there are, in fact, many other strength-based tools for doing community development in health, not just ABCD, but a bunch of others here. I won't go into them in detail, except for the last one, the connected community approach, which is what I want to focus a little bit more on today. Um, but a lot of this work, what it shares in common is harnessing the social capital of a community, not just the bonding social capital within networks, within communities, but also the bridging social capital that links networks together. So networks of care providers, for example, with community-based organizations. And then linking social capital that links vertically to decision makers in a variety of contexts, whether that's municipal government, Ontario healthcare more broadly, or in other ways. And so thinking about is the quality of the social fabric that this work is very much about relationship building within those networks. And one key example that's emerged over the last number of years is the collective impact. Many of you have probably heard of this already. It's basically a way of thinking about how organizations can work together to achieve large-scale social change through coordinated efforts across sectors rather than working in isolation on interventions that have similar aims. And it's a long-term commitment typically from a group of actors to work on a particular problem or issue. There are many examples of these. But they share a common set of principles that are listed here. These obviously are evolving over time because collective impact has gone through several iterations. But you'll notice that customizing for local content and engaging with local players at varieties of levels, including community-led organizations and groups, and fostering relationships is a key element. This document actually by the National Collaborating Center for Determinants of Health is a lovely and in-depth overview. The link is at the bottom of the slide here for those of you who want to learn a little bit more about this. They draw on a number of examples as a case study. You'll notice that many of these are tackling what we sometimes call wicked problems and transigent issues like homelessness, like youth engagement, poverty reduction, and so forth, or broader healthy and vibrant community goals. And so they often set ambitious cross-sector goals to work with partners to achieve significant change in communities. The NCCDH drew a number of key lessons from this work. And I think these are ones that we hear over and over again in the community development and health sector more broadly. The necessity of allowing sufficient time to build and change community institutional relationships, aligning organizational staffing with the new structures, continuous network communication and engagement, finding alignment across worldviews, policy, and organizations. Okay, I think where I was at was the fifth condition here around collective impact, which is what has often been called backbone support. It's making sure that collective impact work is supported adequately with the organization and staff that are dedicated to this work. Because too often, the coordination takes time and none of the participating organizations have much of that to spare. And the expectation that collaboration can occur without a supporting structure is one of the most frequent reasons why collaboration fails. So that's one key learning from this work. Of course, as I mentioned, collective impact has evolved over time, and the work of Mark Kabaj and Liz Weaver at the Tamarack Institute has really been instrumental in my understanding of how this work is moving. And I recommend this document in particular. But you'll see from the table there that the 5 conditions on the left are kind of changing and evolving over time in terms of understanding. And the one in particular that I want to flag here is the change from continuous communication, which was very much agency and organization focused, to a broader emphasis on inclusive community engagement. And that's where the connected community approach comes in, because it's about a centering of community as opposed to an addition of community inclusion to collective impact. So whereas collective impact focuses more on solving complex issues, typically around a well-defined problem, and convening towards a common agenda and trying to move the needle on a population level issue, what a connected community approach does is create conditions for local solutions to take root and grow. It really emphasizes community as an ecosystem that grows and can be strengthened over time, that there are multiple agendas that evolve and intersect, and that can be convened to strengthen impact, and its overall focus is on developing a strong social fabric within a particular geographic context. And so let me say a little bit more about what a connected community approach is. This is something that is a framework and a set of principles and some practical tools distilled from 20 years of frontline experience at the East Scarborough Storefront for sustained place-based action and relationship building to enhance the collective capacity of citizens and institutions to address chronic stressor conditions, as well as prepare for, respond to, recover from, and bounce forward after major shock events, whether that's a pandemic, extreme weather event, mass violence, or some other shock. What it is not is just service coordination. Although it started in that vein, it has evolved considerably to be much more community development oriented. And it's not a pretext for downloading government responsibility onto community. And that last point I'm going to emphasize, hopefully repeatedly in this talk, because I think one of the dangers of this work is that and we saw this during the pandemic, we elevate and turn community into heroes in terms of how collective action and mobilization have occurred. But those don't happen in a vacuum, and they need to be better supported by the institutions and players that have a responsibility also for this work. So a lot of how the connected communities approach has evolved over time, especially as we are applying it in resilience work, is to understand the need for a better connection between citizens and institutions. And in fact, this is a key gap in the community resilience literature more broadly. And one of the reasons that I was so excited to connect with Anne Gloger and the Center for Connected Communities, and saw this work as a key missing piece, because so many of the retrospective analyses of Hurricane Katrina and Hurricane Sandy and so forth, and other major events in the US and around the world have flagged the need for institutions and first responders to work better together. And those first responders are often community themselves. But we don't have a good track record of linking community and institutions before, during, and after in a systematic way. And there are many calls to do this better, but very little guidance on how to do this. The connected community approach, I think, fills that gap in more detailed guidance for how to do this work. So it begins really with understanding that neighborhoods and geographic locations are complex social ecosystems that include not just policies and systems or people trying to improve their well-being at various levels, but also programs and services and other key neighborhood players. The social fabric, as we look at it then in this approach, is defined as the web of interactions and connections that bind us all together as a society. So, in a connected community approach, a healthy social fabric includes community members having a sense of belonging and feeling supported and connected, having meaningful opportunities to learn, having seamless access to supports that they need to thrive, having entry points to meaningful civic participation and the confidence to advocate for what they need, having trust in one another, as well as in the organizations and institutions active in their space, and community members also having respect for and stewardship of the land that in turn nurtures them. A connected community approach also means that organizations and institutions act in ways that remove barriers to opportunity, that focus concerted, collective, intentional processes to unlearn racist, colonial, and white supremacist ways of being and acting, that put mechanisms in place for residents and professionals to design solutions together, that build capacities to collaborate effectively, and that ensure strategies, programs, research, and funding are intended to benefit community are all grounded in the community context. So actually, as I articulate these, I hope you can see that in fact, there's probably more capacity building work involved at the institutional and organizational level here that's required than capacity building at the community level. We often focus on building community capacity to engage with institutions on bureaucratic terms, but actually a lot of capacity is already there. And what we're flagging here is the need to also build institutional capacity to do this work in a good way. And to that end, the core of a connected community approach is what is referred to as the 10 keys, which is a way of distilling some of the key learnings from that 20 years of experience with the East Scarborough Storefront. And the 10 keys are described in more detail in this wonderful online document that I have a link to here. You'll see the order of the keys is a little different here than it was in the previous slide. They're continuing to refine their understanding. But the keys themselves remain the same. And it's about letting values lead, building on everyone's strengths, facilitating collaborative process in a very intentional way, creating connected communities from the inside out, which means investing in the well-being of the people doing the work, learning together, embracing the messiness that is an essential and ongoing feature of community development work, which organizations and institutions that favor logic models and so on have a hard time with. But community development is not easily fitted into the little silos that funders and agencies so often prioritize. And building the creative infrastructure that will allow this work to flourish. The storefront is the kind of backbone organization that I spoke of earlier in the collected impact approach, but with the added emphasis on connected communities. So there's a lot of work that goes into this in terms of connecting local change makers and residents with the policy and programming sector, and a lot of intentional work that makes this community led as opposed to institutionally driven. We feel that this adds value in a number of areas in terms of building relationships primarily, finding ways to strengthen community-led actions. There's a lot of work going on already in communities led by community leaders. And part of what we want to do is kind of what we now call momentum surfacing, which is to look for where there's already momentum in the community and use our privilege and resources and funding and so on to strengthen those and to connect those to other things that are going on at different scales. And integrating into an existing ecosystem and flowing resources into the local community. Part of what we've done as a result of this work, especially around our focus on resilience, is to work with folks at the City of Toronto to identify how the city and community organizations can work together to support and enhance and build community-based resilience. this theory of change was the result of a day-long symposium that was convened just before um, COVID and just after the City of Toronto developed its first resilience strategy with input and support from the Rockefeller 100 Resilient Cities Foundation. So this work is ongoing, of course, but what we aim to do is to create the relational social fabric that knits these various players together. Um, Part of what we did also in this work is use our research expertise and funding from the School of Cities and other sources to look at how the pre-existing social network enables communities to better respond in times of crisis. In this particular work, we were looking in partnership with the Center for Connected Communities at community response to COVID. Um, and part of what we did was, in addition to a Gray Literature Review, was interview 46 grassroots leaders as part of the Local Champions Network, and convene a series of sense-making workshops with neighborhood leaders that produced, in addition to a number of academic papers and policy papers, a podcast series profiling the work of community leaders and also speaking to this issue of the quality of the relational fabric, not only within communities and neighborhoods, and we focused on 6 racialized low-income neighborhoods in particular, but also between residents and institutions that are engaged in these spaces. And we looked at in not only in East Scarborough, but in a number of places about how the social fabric that pre-existed COVID was leveraged during the pandemic to in a number of ways to improve community well-being, and how that worked in concert with a number of agencies who were active in these neighborhoods. And so part of what we found is that grassroots responses are absolutely critical in moments of crisis, that grassroots leaders were able to reach vulnerable residents while formal organizations and institutions were often unable to, that they leveraged pre-pandemic networks to respond to the needs of their neighbors, that unfortunately, without intentionality, what happens at the city during a crisis and what happens on the ground are woefully disconnected. A lot of agencies pulled up stakes pretty quickly when the pandemic hit and when the lockdown happened, and reassigned frontline staff to other COVID-related duties without any understanding that it's the frontline staff that community members themselves have a link to. Without those personal links, there is no link between community and institution. And too many institutions forget that their frontline staff are part of the relational social fabric that residents rely on. And institutions are used to thinking of themselves as org charts that you can interchange the widgets on the org chart without consequence to suit institutional needs, without paying adequate attention to the relational social fabric that's ripped apart in the process of doing that. So really what we're calling for from this work and documenting through this research is the need to connect grassroots and grass tops to function more effectively together. And this work has been published in a number of venues, but really what we emphasize in all of this work is that relational accountability of institutions to community is ground zero for personal, institutional, and collective action. It's all about relationships. And so how we intentionally cultivate relationships and strengthen that social fabric is how we make long-term transformative change on the issues that we're most passionate about. And we do that with communities in a very particular kind of way that builds on decades of understanding of how community development in health works. And this is echoes very much what we see as the relational turn in the social sciences. And I'm drawing on sustainability science here because that's where a lot of my work has been in the last 15 years. But you'll recognize the components of the relational turn on the right there as much broader than just sustainability or health. And we're really reflecting a much wider recognition in the social sciences that we live in a relational world, and we this is a an eye opener for a dominant society that is primarily transactional in nature, and most of our policies and programs are transactional. But when we understand that it's all relational and that power relations are part of that mix, then we can start to transform how we do this work in a much more intentional and relational way. And a lot of that stems from, how we understand community and how community functions to support, especially marginalized communities. I think those of us with sufficient privilege to meet most of our needs in the marketplace don't fully appreciate how essential community is for marginalized groups and, in fact, for all of humanity, for most of human history. We've allowed ourselves to untangle, those of us with privilege have untangled ourselves from community, the messiness of it and the challenges of it. Um, but ultimately, that is what is going to carry us forward in the multiple intersecting challenges that we face in the coming decades. And so I invite you to also think about what your learned experience of being in community is and how that informs your work. So, I'm realizing I'm a little behind in time. There's a number of implications for theory and practice in this work that I wanted to highlight. They're just listed here. I was going to go over each one of these, but I think I want to also have some conversation and debate and discussion with you. So I'm going to skip pretty quickly over these. Some of these have to do with what kind of staff do we hire and what kind of skill sets do we promote within our institutions that support and enable this work. Part of it has to do with what's the level of commitment that our organizations are engaged in this work are willing to make. And in our early work on public health and community development in health, we found that only one of the case studies, I think we did 9 case studies across the province, only one, and interestingly, at the time it was Peel Region, had a medical officer of health who was deeply committed to community development and made it a cross-cutting theme and focus for every aspect of what Peel did. And I think that sets some really important groundwork for what's possible in Peel in the health sector as a result. Um, we also need to attend to the very real differences in perspective and worldview between hospital and community. And this is perhaps over essentializing the 2 columns. There are, in fact, multiple communities within the health sector and within community. But there are some important cultural differences and some incentive structure differences that we need to attend to when we do this collaborative work. There are also a lot of assumptions about community engaged or community led work. And the reality often doesn't match up. We tend to assume that everybody's genuinely interested in doing this work together, that important knowledge is generated that will be used in significant ways. But the reality of community engaged work in this space is often falls quite short of that. Um, and I cut my teeth on this in my PhD many moons ago, and it was all about this kind of collaborative work. And we saw many agencies coming to the table, mostly because they wanted to protect their turf, not because they actually wanted to make meaningful change. In fact, big initiatives also often cause people to feel like they're being shown up in some way for having not done this work before the new initiative parachuted in. And so those are some of the realities that need to be dealt with as much as possible. And we gathered in this work a lot of advice from the field about how to do this work in a more conscious way. that attends to some of these dynamics in terms of power and resources and perspective. I'm not going to go into all of these now, but a lot of these came from community groups that were engaged with hospitals and the health sector in this collaborative work. So we can trace back over this in the Q&A if that's helpful. I wanted to also say that typically we take a social planning approach in this work in the health sector, and part of what my work has been dedicated to, but of course I'm not alone in this, is really pushing the health sector to move out of social planning and into locality development and social action. And there are some very stark differences between the more technocratic, top-down, health sector-driven work that characterizes social planning and what locality development and social action look like. And I have entire courses that basically trace this out in more detail. So we don't have time to get into that today. But I want to also say that the relational change work that we're talking about is a lot of what's below the iceberg, so to speak, of this work. We often focus on that top tier of changing policy practice and resource flows, but we need to also be attending to the relational work at the middle level and the mental models that inform a lot of the work that we do here. And I love this work by Kanyan Kramer and Peter Sangay on the water of systems change. And there's some really interesting work being led by Manuel Reimer at the University of Waterloo about how to translate that work into what they call strategic management innovations at a local government level. Um, and they've done some really interesting work with Kitchener to embed this work into local government and completely transform how government approaches complex systems work informed by complexity and systems theory. So do take a look at Veris and the Flourishing Enterprise Institute and some of the work that they're doing there if you want to follow that in more detail. And of course, there's a whole set of issues associated with how do we evaluate this work and the politics of evaluation. Who are we evaluating for, and who's on whose terms, and how does this inform our work? The need to take a more developmental evaluation approach that Michael Patton has, and also an appreciative inquiry approach to this work. So I've glossed over a lot of things here. There's all kinds of epistemological and ontological issues to address. We've tended to take a more critical realist approach in our work. That's a whole other conversation we don't have time for here. But I also wanted to flag that there's a lot of work still to be done in developing adequate racial justice frameworks for this work. And I've been really jazzed about the work that some members of our team are now leading, in particular Amara Rolston's work with the community climate justice resilience work that they're doing at the lab that they've founded at Daulana in partnership with a number of groups. So thank you. I've thrown a lot at you. There's a lot of ways to follow up on this work. I provided a couple of links at the top here and some references to our work, but I want to give a few moments for discussion and questions and comments. So I'm going to stop share. Happy to, there's a recording as Lorraine mentioned, but I'm happy to also share my slides so that you have access to some of this work going forward. But I'd love to hear how this resonates for you and any questions, comments you want to bring forward. And I
Thank
see
you.
that Richard has, Richard and I
Yeah.
go way back, so I'm delighted to see that Richard is here.
Yeah, why
And
don't you? Thank you so much, Blake. What a wonderful whirlwind of of trying to bring to us a very complex complex what do you concepts and very very enlightening and very useful. And I think I understand that it's hard to go through that all in 40 minutes, particularly when you had internet issues. So why don't we start with Richard's question? Where is the conflict? So sorry, I'll read this. It just popped off my screen. Where's the conflict between power-based organizations such as governments and wealth-gaining minorities, capitalists and their monopolies, versus communities of working people who are exploited as a class? Maybe you could comment on that.
That's a great question and a lot to digest there. What I want to flag first of all, I think Richard, uh, just from what I know of your work and our conversations over the years, as well as what's implicit in the question, is more of a political economy approach to understanding the nature of this work, and that's not something I really addressed explicitly in this presentation, but I'm glad that you're raising it because that's a whole other layer in terms of understanding power relations and the broader social context in which this work is unfolding. So the connected community approach itself has, for a variety of reasons, chosen not to foreground some of that understanding, but the impetus behind community-led work is to put as much as possible residents in the driver's seat, especially in marginalized communities, having resident leaders who are not part of the dominant systems be in the driver's seat for the change work that gets done, that addresses not just community perceived needs and priorities, but also aspirations and goals. And to rally the institutions that are seeking to work or engage with these communities, rally them around the community-led solutions and initiatives first and foremost, and to develop the relational fabric that will allow those ongoing conversations and bring the grassroots and the grass tops, so to speak, together. I know that doesn't fully address your question, Richard. We would have to have a much longer conversation about the nature of society as we understand it, and the ways in which structural determinants are undergirded by what Vanessa Andreotti at UBC calls coloniality modernity, as a hyphenated word, as a way of understanding the nature of our the way the world is structured at the moment. I usually include in my talks a slide that's actually made by a Toronto-based cartoonist that shows a huge machine driven by a fat cat at the top, the 1% industrialists who are vacuuming up cheap labor and resources and spewing out consumer junk designed to fail shortly after the warranty expires and creating environmental destruction. And as a shorthand way of just describing how we live in a world at the moment that is designed primarily for the accumulation of wealth, especially in the hands of the 1%, rather than the generation of broad well-being for communities and individuals. And that is the backdrop for all of the work that we're doing in community settings. And I think I want to thank Richard for bringing that piece forward, because I think at some level, a political economy or political ecology perspective is absolutely necessary for understanding the limits of community-led work and the structural drivers that we're working upstream against in this work, that are too often seen as not feasible or not proximal enough to be the focus of our work, but I think we ignore those issues at our peril.
Oh, Blake, thank you. I know it's a lot to unpack and a lot to think about. And when we think about politics and sort of that whole kind of, you talked about the mental model is the sort of ultimate kind of goal at the bottom of your pyramid of changing people's mental model about things. And, over the last 30 years, we've definitely, or more, we've seen a real shift in kind of, prioritization of policies for wealth acquisition and profit rather than well-being and health. And I see it in my teenage kids and sort of thinking about career paths and what's being valued, right?
Yeah.
making money is being valued, which is, anyway, that's a whole other topic. But maybe on this topic, if other people have questions, please raise your hand or put them in the chat. And while we're waiting for questions, I might ask one. So, we here at the Network for Healthy Populations, we are, an academic research network, right? And by just with that title and by nature and by reputation, academics and scholars are seen as sort of, elite, almost, um, ivory tower or whatever you want to call it, sort of a top-down type of or people. And so, how do you view, with your concept and your model, how do you view the scholar in that work? What is the role of the scholar?
Yeah, thank you, Lorraine. I really appreciate that comment. And I could have drawn a little bit more on that in my talk, actually, in retrospect. Uh, One of the folks at the Center for Connected Community and I gave a talk a couple of years ago on exactly that issue of the town gown relation, rethinking the town gown relationship. But I think that academics really struggle with this because the trust-based work that needs to happen to build relationships to make community-based research function well is not work that's generally visible or rewarded in the incentive structures that academics find themselves in academic institutions. I think we see some really important leadership on this from our Indigenous colleagues, because doing work in Indigenous communities has its own host of issues and protocols. But I think that more generally, community-based research has really struggled for a whole host of reasons, and continues to struggle. One of the reasons that I've been so delighted and keen to work with the Center for Connected Communities in the East Scarborough Storefront is that they've been an absolutely invaluable go-between. They have the deep roots and connections that made a level of work that we've engaged in that would have been really impossible otherwise. And I think it's these kinds of partnerships that we need to be looking to when we engage in this work, because to do that work directly, I just, even with my 30 years of community development experience, really would not have been easily possible. So working through C3 and now what's called the Catalyst Circle has really been such a boon, I think. And I think Anne Gloger, who's the principal of the Center for Connected Communities and C3 and the Catalyst Circle, would argue that from their perspective, partnering with academics has allowed them to build and extend the evidence base for this work and for our connected communities approach, as well as ensuring that the research work that gets done and the intervention work is well grounded in these principles. So I didn't mention it here, but we're engaged in a new project funded by SSHRC. It's a 5-year funding, which we've now renamed. It was originally talked about or named in the proposal as a urban living lab, but you can appreciate communities don't like to be thought of as a petri dish for academic work. So working with the Storefront and the Catalyst Circle, we've reframed that as visionary communities. And our work with them has started with what I mentioned earlier as a momentum surfacing work of mapping the community-led initiatives and where the energy is in the Kingston Galloway area, and then resourcing that and building on that. So we're inverting this work is more focused on climate resilience and climate mitigation and adaptation, but we're inverting the usual structure where we work with communities to identify co-benefits to make the climate-based work more palatable. And instead, we're focusing on the co-benefits themselves as the starting point, and seeing the climate mitigation work as the downstream kind of co-benefits of the primary work, and working with communities to envisage more sustainable futures. So I think there are fabulous ways to leverage these. I know that I don't know if she's on this call, but we did a bit of work with Kathy Wilson in Peel to try and look at how can a connected communities approach inform some of the COVID related work that Kathy was leading there. And we did some work to identify who the backbone organizations might be in Peel, and the significant work that Peel Region did with faith-based organizations and a number of other groups, cultural groups in particular in Peel during the pandemic, that could be, I think, very interesting building blocks for the kind of work that the network is wanting to do in the coming years in Peel. So that's a bit of a long-winded answer to your question, but I hope I actually did answer it.
No, you did. Thank you so much. And as always, your wisdom is so valuable and appreciated. And I realize we're already over the top of the hour. Or no, more just I'm sure we could continue to discuss, and this has been really, really thought-provoking and interesting. I want to thank you, Blake, so much for delivering such an insightful and thought-provoking presentation, and for all your hard work in this area. And I'm sure that people have, other questions. They thank you for offering to for them to reach out to you. We will also have an opportunity to, if for those who missed the talk or would like to watch it again, we will have it on our website. And also, yes, if please reach out to Blake. He's graciously agreed to share his slides if you have any further things that you'd like to look at more closely. So once again, thank you everyone for joining, and please join me in thanking Blake Paulin for speaking today. Please ensure that you complete today's evaluation for this session. Lydia will add the link into the chat pod, and we'll also send it to you directly via email. Our next session will be on May 27th, speaker yet to be determined, but you will look in your email and you should receive an invitation soon. Thank you very much, everyone. We will let people go at 3 minutes past the hour. And thanks again, Blake, for a wonderful talk.
Thank you so much.
Okay, bye-bye, everybody. Take care.